We want to remain cautious and keep doing what's working. Keep applying these steps. I'm grateful to every Arizonan for participating and doing their part. Now let's talk schools. When it comes to our schools, I want to thank all of the superintendents and school leaders who are working closely with Arizona Department of Education, Superintendent Kathy Hoffman, and DHS to prioritize our kids. I also want to recognize the countless Arizona businesses, employers, and employees who have had to make sacrifices. We know it's been incredibly difficult for so many in our state, and we want you to know that we're listening and we're continuing to do everything that we can to help. So we can't let up. We can't let our guard down. We can't lose these gains. We are not taking a victory lap. This is not a celebration. This is a highlight on what's working and an ask that we continue doing what works. Many have asked, how and when can we open Arizona safely? How do we achieve healthy lives and a healthy economy? Well, here's how. We're going to continue to be guided by the data and the doctors. We're constantly seeking the input of our medical experts, both at the state level and the federal level, along with community leaders to determine the responsible way to reopen our businesses so that everyone can resume their lives safely, sensibly, and responsibly. Returning our kids to the classroom, reuniting with our loved ones, all of these depend on continued responsible behavior that you have demonstrated so well for so long. So I urge everyone to stay the course, stay physically distanced, stay smart and healthy, and continue to mask up.
Governor, the state is clearly divided on a number of issues. Parents and teachers are fighting over the issue of going back to school. Teachers calling out sick, bar owners frustrated with the system of who gets to open, who doesn't, issues with data and not all of the data being included for key metrics. As the state's chief executive, do you have a message to try and unify all these groups?
Well, I want to acknowledge that I think it's accurate that people are very divided on a number of fronts right now. What we would try to do from a unifying message is that we're going to follow the science here. I mean, we're going to focus on health and safety. And as I've said several times before, when you talk about schools reopening, there are some parents that want, as soon as it's possible, to get their children back into a classroom. And there are parents that we all know that are not putting their child back in a classroom. So what we've tried to do is to provide options for both these parents, for both these families. We've also have some teachers that are in a vulnerable category or have an underlying health condition, and we will need online learning in this hybrid model. So we're trying to, in a very difficult and challenging time for our state and our country, to provide the smartest plan of action that we can. Now, when you talk about the data, our data by independent sources that work with Johns Hopkins and the New York Times and the Wall Street Journal rate Arizona's data at A+. If you've got a specific question around the data, you can ask it. But our data is put out there every morning. I think it's live at 9 a.m. And what I'm here today talking to you about is the strength of that data. And that data puts us in a different position today than we were 4 weeks ago. What we don't want to do is let our guard down on it because we don't know what's in the future. The virus is unpredictable, and we do have flu season ahead of us, even though on days like today, it doesn't quite feel like it.
Governor, can you make a commitment to Arizonans to be more present, not campaigning with President Trump, to guide each of these issues instead of local jurisdictions trying to maneuver where to go and what to do?
I'm focused 100% on my day job every day. What we want to do is, like I said, continue to be data-driven, working with the medical health professionals, both at the state and federal level, with the focus of health and safety, while at the same time realizing it's a big state and the situation is different in different parts of the state. So where possible, there will be local control and necessary and appropriate individual freedoms.
But what is your message of unity for the state? And what is your message of unity
My message
for the
for
state?
unity
And
is let's wear a mask, let's wash our hands, and let's be physically distant.
But my last part of that was, will you reach out to any teacher groups to try and unify the state teachers, or will you continue your practice of not dealing with the AEA?
I work with teachers, I work with superintendents, I work with principals. We'll continue to do that.
You know, with kids going back to school, some virtually, some going in person, how can you support being back in the classroom when not all benchmarks are being met by the counties?
I want people to follow the benchmarks, to follow the guidance. Like I said, when you look at the details on it, 2 consecutive weeks with a 12-day lag, we're headed in the right direction. I think I saw breaking news as I was heading in here that 4 counties qualify today. Several counties are on the cusp of a week away. So again, what we're doing is being as safe and responsible as we can, and also providing flexibilities to parents depending on what the decisions are. Where the situation warrants, there's going to be a local decision. So we've provided that flexibility in the guidance.
But do you think all benchmarks need to be met for districts to consider going back in the classroom? These are benchmarks that are put out by the Department of Health.
They're guidelines, and I think part of it is trends are important, and also situations of dealing with teachers and parents. So we put this together with input from the public school superintendents from around the states, principals and stakeholder groups. So we think it's a good plan.